Did you know that breastfeeding is not a foolproof method of preventing pregnancy? It's true. And today we're diving deep into why so many parents get surprised by this. A lot of new moms hear that as long as they are breastfeeding, they can't get pregnant. It sounds comforting, right? But the truth is, it's a myth that can lead to unexpected pregnancies if you're not careful. Here's what really happens. Breastfeeding can suppress ovulation. That's the release of an egg from your ovaries, especially if you're exclusively breastfeeding on demand, day and night with no long breaks. This natural suppression is called the lactational amenorrhea method, LAM, and when practiced strictly under certain conditions, it can be up to 98% effective. But, and this is a big but, those conditions are very specific. Your baby must be younger than 6 months old. You must breastfeed exclusively, no formula, no solid foods. Your periods must not have returned. As soon as your baby starts sleeping longer stretches at night, or you introduce even a little bit of formula or solid foods, your hormones begin to shift. This shift increases the chances of ovulation, even if you haven't had a period yet. Here's something most people don't realize. Ovulation happens before you get your period, not after. So by the time you realize your period has returned, you could have already been fertile again for weeks without any warning. That's why relying solely on breastfeeding as birth control is risky unless you're meeting all the strict LAM guidelines. And even then, it's not 100% guaranteed. Let's look at a real-world example. Imagine a mom who breastfeeds her newborn exclusively for the first 3 months. As her baby grows, he starts sleeping 6 hours at night. Sounds like a dream, right? But without her realizing it, her fertility may have quietly returned. She thinks she's protected, but she could conceive if she's not using any other form of contraception. Research also shows that even among breastfeeding moms, 20–30% may start ovulating before 6 months postpartum. That's a significant number, and it's why doctors recommend using additional contraception like condoms, progesterone-only pills, or even an IUD if you want to delay your next pregnancy. Here's a parenting tip from my experience. If you want to avoid surprises, talk with your healthcare provider about the best contraception for you postpartum, especially once your baby's feeding schedule starts changing. Remember, every body is different. Some women regain fertility quickly, others take much longer. There's no perfect timeline, and breastfeeding can't predict how your body will respond. Now I want to hear from you. Have you ever been told that breastfeeding is a natural birth control method? Do you think it's safe to rely only on breastfeeding? Or should we always have a backup plan? Drop your thoughts below. I would love to hear your experiences and stories.